Welcome, everyone. Welcome to the Industry Insights into Community Health, Healthcare and Social Assistance. My name is Keith. I am from Wyndham City Council. I'm the area leader of the local jobs team here, looking after the industry-facing components of our Opportunity Wyndham partnership. Industry Insights is an industry event that is hosted in collaboration with the Gordon. We run this every month, and every month we focus on a different topic. Today's topic is on healthcare. So we have got the privilege of bringing together distinguished panel members from a range of different industries across healthcare, community support, practitioners as well, and stakeholders who are at the forefront in each of their respective areas. Before I commence the event today, and just quickly, I think we've got Surya is in the background. Awesome. Hello, Surya. If you can keep an eye on the chat for me, Surya, that would be super helpful. And on the admissions into the session today as well, that would be super duper helpful. Thank you, Surya. Before we commence the event today, I would like to begin with an acknowledgement of country. Wyndham City Council recognises Aboriginal and Torres Strait Islander peoples as the first peoples of Australia. We recognise and acknowledge the Bunurong and Wadawurrung peoples as traditional owners of the lands on which Wyndham City operates. The Wadawurrung and Bunurong peoples have and always will belong to the Werribee Yallook, the Werribee River, creeks, the stars, hills and red clay of this country, and we pay respects to their ancestors and elders who always have and always will care for country and community today and for future generations. So let me get myself sorted. Everyone, as I'm having blank stares only because we're waiting on two panel members and I'm just trying to see if they have joined. Yes, we have Marie. Bear with me a second. Where did Marie go? Here we go. Hello, Marie. Thank you for joining.
Hi, how you going? Sorry.
Good, great. Thank you so much. And is Abby joining you as well today?
Potentially, but not. She will be in her office.
Okay. Okay, I haven't seen Abby so far, but that's not a problem at all. Beautiful. Where was I? Okay. So allow me to introduce our speakers. You can see them all on the screen now. I'll spotlight you as well, Abby, so that everyone can see you. And we've got Nis spotlighted as well. I think that is it. Yep. Beautiful. We're honoured to have with us this afternoon Yolanda Sutherland, who is the Acting Manager of People and Culture at IPC Health. Give us a wave, Yolanda. Thanks. We have Jenna House, who is currently the Acting Manager of Community Support at Wyndham City Council. Hello, Jenna. We have Marie Payne, who is the General Manager at Mercy Health. Hello, Marie. Thank you for joining us. We also have Minnie Dyer. Now, excuse my pronunciation of everyone's names today, from the Gordon TAFE. Hello, Dyer. Thank you for coming, Minnie. And also Nis Patel, who's the General Manager at Felicity Holistic Care. Thank you for joining us as well, Nis. So everyone tonight serves as a platform for these professionals to share their knowledge and experiences, essentially fostering an environment of learning and collaboration, which sits at the heart of what Opportunity Wyndham, our partnership, does. We'll dive into the latest trends and challenges that are facing community health, healthcare and social assistance, and hopefully you'll gain some valuable insights into these different fields as we progress today. This event presents everyone here today with an exceptional opportunity to explore the different and diverse career paths available in community health, healthcare and social assistance as well. Our panelists will shed light on the various types of work that individuals can engage in and expect when engaging in these pathways to make a positive impact on the lives of individuals and communities at large. I am now going to kick off with Jenna House. So as I mentioned, Jenna House is currently the Acting Manager of Community Support at Wyndham City Council. However, in Jenna's substantive position, Jenna is the Coordinator of Service Development and Strategy. Jenna leads a team that delivers strategic projects supporting residents to access and participate in community-based services across their life course. She is passionate about evidence-based decision-making and ensuring policy and programs are continuously improving to meet the evolving needs of the community, which we will also get into with some of the questions today. Prior to joining Wyndham City Council, Jenna held roles within the Victorian Department of Health and Human Services and the National Disability Insurance Agency. Jenna is also a qualified podiatrist and practiced in community health for several years before pivoting to the policy and service delivery and design space. So, Jenna, you have held some fairly important roles within the Department of Health and Human Services and the National Disability Insurance Agency. Are you able to share some key insights or experiences from those roles that have significantly shaped your current work today?
Thanks, Keith. I can, and I just wanted to add that I'm really excited to be here today. Community health, healthcare, and social assistance are some passion areas for me in particular, and have really been some of the areas that I've focused on throughout my career. So this is a really great question. So I think one of the insights that I've had in my career through working with the Department of Health and Human Services and the National Disability Insurance Agency is that I've kind of come full circle. Working in community health as a podiatrist, I got to prepare the organisation for the transition to the NDIS, and soon after started working at the NDIA, implementing this national and very significant reform in Western Melbourne. Western Melbourne was one of the last areas for the NDIS to be rolled out to, so it was a really interesting experience being at the forefront of that reform, and then transitioning over to the Department of Health and Human Services to support organisations like Community Health to implement this reform. So I think the insights that I gained from those experiences was that I got to see across the board some of the challenges and complexities of implementing that reform on the ground, and then working with multiple stakeholders across the disability sector and in government to adapt their business model to implement the reform itself. And I think through that experience, it really enabled me to develop a strong interest in evidence-informed policy development and service design, and that kind of led me into local government. It is the tier of government that's closest to the people, and I've really been able to use some of those skills and the experiences that I learned through working in those two environments and applying that to the local government work that I do today.
Beautiful. Thank you for that. Sorry, everyone, managing the attendees as well. And it looks like Abby has joined us as well. Abby, we're just giving you permission to have your camera on and to speak. I'll add you as a spotlight. Beautiful. Sorry, Jenna. All right, where was I? Goodness. I guess you like local government. I mean, you've been attracted to local government. Don't blame me. It's what's brought me to this beautiful sector as well. It's the closest sector of government to community. I guess in line with Wyndham specifically, the local government of Wyndham, and being one of the largest and most diverse growing city councils in Australia, what strategies do you employ to effectively address the increasing demand for community services and maintaining a high quality standards? I mean, from what I've seen, it's mad. Yeah, power to you. It's a hard job. So how do you do it?
Yes, well, so in my area at the moment, I hold the portfolios of maternal child health, immunisation services, youth services, age and disability services, and kindergarten services. So our department is made up of roughly 600 staff. We have quite a number of diverse roles right across all of those services. And we really rely on feedback from the community to inform the design and delivery of our services across the life course. We rely on lots of different data sources to inform our approach to planning. So that can be population forecast data, some of the forecast modelling that we do, some service engagement trends. We also connect a lot in with our service provider networks, and council facilitates a number of service provider networks specifically for youth services, for child and family services as well. And we rely on a lot of the information from our local providers to inform our understanding of community needs so that we can design our responses to meet those needs. We also partner with a number of those service providers too to deliver our services. So in the early years space, we have a number of early years providers that deliver kindergarten services from our council buildings. And we also run a number of events and programs targeted to communities who require additional support when needed. So really, I would say that it's a lot to do with developing and understanding a community need through those data sources and those information sources.
Awesome. That is a lot of programs. That is a lot. There's a lot involved in your work, and I guess the work of local government broadly. So Jenna, for those who would like to learn more about what's on offer through those different programs and the vast majority of pathways in that area, and those particularly say offered by Wyndham City Council, what resources would you recommend people could explore to understand that?
I think that Council's website is a good start. We have a lot of information on the community programs and services that we offer through our website. Signing up to Council's social media as well. Our Instagram and Facebook pages have a lot of information about the services and programs that are available locally. We have a What's On section in our website that gives you the latest information about what's happening across each area across the municipality, and that gives you an idea of the breadth of services and programs that are available. And then I would also encourage people to head to the local library or to the community centre as well. There are a number of programs that are offered in those spaces for people across the life course, and that kind of gives you a sense of the different opportunities you have in the sector to engage with the community. Another sort of area that I think that is worth mentioning as well is our Community Connector service. So we have a dedicated team here at Wyndham to help residents connect to local service options where they can find direct support services, get referrals, or provide information on topics such as food relief, mental health, family and youth support. And they're another good resource to tap into about what's available in Wyndham.
Thanks, Jenna, for sharing all of that. For people, so I've discovered this beautiful pathway that I want to enter down, and I'm progressing my interests in that sphere. What do you think are some of the unique challenges and opportunities that Wyndham City Council can offer a potential employee, say within community support or the community support sector?
Yes, I think that one thing, if COVID's taught us anything over this period of time, it's that we can adapt and we can connect with the community. We can hear about what they need in the community and change our services to meet their needs quite quickly. So I think one thing that we've done in our area over the last couple of years as a result of COVID is to really diversify the mix of professionals that we have available at council. So we have a number of multidisciplinary roles across maternal child health and in our kindergarten services. So for example, we have our child and family resource officers. They run a lot of programs with families and parents. We have lactation consultants that are now in maternal child health to help maternal child health nurses and families with feeding support. We have a family violence worker, social workers, youth counselling services for children and youth available to the community. So we've really diversified the skill set and the mix of roles that are now available across council and in community support. And that's really in response to some of the challenges and the issues that we're seeing in the community and that additional need for support coming out of COVID as well.
Fantastic, Jenna. Thank you. Now, you've had a really diverse, broad range of different experiences from frontline service delivery as a practitioner right through into quite senior strategic leadership and service delivery, service design perspectives. Drawing from your extensive experience and accomplishments, so many accomplishments, I'm sure. What advice would you give to someone that's aspiring to grow and to succeed in that space, and that are looking to really build a diverse career in community support, healthcare, community health broadly?
I think that the community support and social services sector is so incredibly broad and the opportunities are endless. I think that one thing that has probably worked for me is following my curiosity. So, you know, I started out in clinical services in community health. There was this new reform coming on board that it kind of piqued my interest in how this was going to be rolled out broadly across the country. And then, you know, sort of through that experience have kind of found an area that fits my strengths and my skill set and something that I wanted to, and areas that I wanted to continue to develop in my professional career. So I think following your curiosity, no matter where you start, and keeping an open mind about opportunities as well, because, you know, it may be that instead of progressing up, you progress sideways, you develop a new skill set, and that kind of propels you and moves you forward into another area that you would never have thought that you would have gone into. And that's certainly been the case for me throughout my career. I would also say that networking and getting to know other people across the sector and being curious about the different types of roles that other people are doing by having a look at LinkedIn or and looking up organisations that you'd like to work for and you'd like to know more about has always been really valuable for me as well. So yeah, I think being curious and keeping an open mind would be my advice.
And that is great advice, especially coming out of COVID. I think, as you mentioned in a number of your responses, Jenna, the way we deliver services, the way we work has changed. And I think it really comes down to having mindsets like that, being curious, being adaptable. Beautiful. Thank you so much for sharing that, Jenna. Thank you so much.
Thanks.
All right, I am going to pivot myself now and jump across to Marie, who is a general manager for at the Werribee Mercy Health Hospital. Marie was appointed as general manager of Werribee Mercy Hospital in January of 2022. This role has operational responsibility for all aspects of management and leadership of the Werribee Mercy Hospital campus. Marie is an experienced health service professional with 30 years experience in the health industry in both the public and private healthcare sectors. With a clinical background in nursing, Marie also has extensive experience in hospital redesign and redevelopment. Prior to commencing with Mercy, Marie was employed as the Divisional Director of Emergency Medicine and Access at Western Health. She is dedicated to leading teams that provide patient-centered care with an emphasis on the provision of a positive patient experience, which includes the acknowledgement of the clinical, physical, and emotional experience. Marie has a strong desire to develop healthcare professionals at all levels to understand how their roles can help build and help create a positive patient experience and outcomes where patient experience is viewed as a whole healthcare conversation, issue, and opportunity. So Marie, with all of that, that long career history, that's fantastic
you make
to
me
see.
feel old when you say 30 years.
Not even old. I think to have a career of double digits in the healthcare sector, I think is something to be celebrated, given how challenging of a coming out of that sector myself recently. I think it's commendable, really commendable, Marie. So given that broad experience, could you share your journey in healthcare from nursing to hospital management? How has this experience influenced your role as a general manager at Werribee Mercy Hospital?
Yeah, it's a good question. I think, and I've reflected a lot on this. I graduated, way back in the early 90s, and at the time was pretty lucky to be able to do my grad year in nursing at Alfred Health. And, when probably halfway through my sort of tenure there, I was there for 14 years, and I was in a department called Hospital in the Home, so obviously providing care for patients in the community. And the manager had left, and they weren't able to get anyone to recruit. And I was in, I don't know, the right place or the wrong place at the right time, and was asked to do the role. And I remember at the time, Alfred Health at the time there was a lot of very experienced managers there, and I was 28 and, you know, the youngest one there. So it was quite a bit, you know, daunting really. But when I reflect back on my career, what the Alfred probably gave me at the time, and when I think about people who've influenced my career, we had a new CEO at the time, and there was a lot of issues with access block. Couldn't get patients into beds. There just simply wasn't enough there, and was given this brief to increase our ability to manage people at home by 25%. And, you know, literally it was go away, make it happen. And I think what it gave me was, you know, this ability to believe that there are solutions to every problem. You need to think outside the square, particularly in health. It's constantly evolving, and, you know, no 2 days are the same. So I spent quite a while at the Alfred in that environment. So, you know, you naturally became quite agile. I really like change. I like things constantly moving. And then after that, sort of, I took a sidestep, you know, similar story. You know, sometimes you take the sidestep to move up, and took a sidestep across to another organisation and just was ridiculously bored. It was too quiet because I'd been used to this pace, and, you know, was putting my hand up that I wanted more. And I was offered an experience by someone to work in medical workforce, which was just completely outside my scope. I didn't have any experience, but what that probably did was catapult me really into that operations world, because you end up getting quite diverse experiences. And, you know, one of my messages to the team is, you know, when you're offered an experience or an opportunity, even if it's a short-term secondment, you know, never say no, because it's going to give you a set of skills or challenge you or push you in a way that you normally wouldn't. And so after that sort of opportunity, I ended up going into not-for-profit. And, you know, interestingly enough, I think the last 4 roles I've had, every organisation's gotten funding for a new emergency department, which we're also got here at Werribee. So, you know, again, opportunities that you don't really get to have in your career. So I think, you know, recognising, being brave to, you know, take on new opportunities.
Intentional staff,
Sorry, we've
on
just got
Coatbray, opposite radiology, main corridor.
Apologies, just got a PA. So be brave, take on opportunities. Don't be afraid to be stretched, and, you know, progress your career with the view that you really want to expand your skill set. Like, even though my background is nursing, my experience is quite broad beyond that, and it gives you a different lens, I think, than when you sort of, you know, you find yourself in positions like this one.
Fantastic, Marie. Thank you for sharing. And you mentioned the increased funding for emergency. We've got all this new emergency funding, and I think coming out of COVID, there's all sorts of challenges as a lot of our communities are still recovering even today. So on that point, Marie, what do you think are some of the most significant challenges facing healthcare in, say, Wyndham today, and how is Mercy Health addressing those challenges?
Yeah, so I think first and foremost is that demand for healthcare, and, you know, for all of health services, how do we make sure that we're able to provide timely care to patients? And that's whether they're coming in, you know, via the emergency department, or whether they're needing to have, you know, elective surgery or access to community services, etc. That's probably the first and foremost. And then coupled with that demand is the growth in the community. So we know that, you know, by 2036, Wyndham's going to be the size of Canberra. And when you put it into that perspective and you think about the size of the hospital here, or the services and where they're at, you know, we're thinking about how do we become a self-sufficient organisation, and for this hospital, so that patients in Wyndham are able to come here for all the care that they need, and not have to potentially be transferred out for some type of speciality care. And that involves a lot of, you know, working on clinical services plans or models of care. So lots of work being done in that space, I should say. The other interesting component for Wyndham is, you know, there is a lot more. It's not a population that's dense in terms of the elderly. There's a lot of families, a lot of paediatrics. So the impact that has definitely on our emergency department and our number of children that present, and how we have to think about our emergency models of care a little bit differently to be able to manage that demand as well. I think the other big challenge is workforce. You know, we've touched on that, and I think it's affecting everyone. You know, specifically, I think in health, there's two components to that. There's the burnout in healthcare that's happened post-COVID, you know, that's affected, you know, I'd say all of us, and, you know, particularly out in the West where our COVID presentations were a lot higher. So the impact of that was a little bit greater. And, you know, from a workforce perspective, it's around that sort of speciality workforce. So, you know, looking at whether it be nursing and midwifery, or some of our more specialist medical staff that might be emergency physicians or anaesthetists as well. So they're probably the, you know, if you had to sort of rate the top four challenges, I think they would be it.
And so on that workforce challenge, Marie, I mean, that's across the sector. I'm one of those ex-healthcare employees that fled the sector.
Yeah.
What strategies are in place at Mercy Health to address this into the future? I mean, there's a lot of workforce forums, even at a state and federal level, trying to address these national shortages.
Yeah.
What is Mercy doing?
We've done a few things. So one of our significant gaps was what we would call in our environmental services area, so our patient services, so one of our support services. So we partnered up with local TAFE institutes and actually offered a supported Certificate 3 in health administration. So we started that program this year. And had our first intake earlier on in the year, and have got another intake planned, and that's been really well received. So that was an opportunity for, you know, people who might have been thinking about getting into health to do that in a supported way with education, on the job training, etc. Feedback from, you know, our first intake has been really, really positive. So we're getting a lot of interest in that space. So that's definitely something that we're going to continue to work with, which was successful. If I then look at, I suppose, the nursing space, you know, again, in some of the specialty areas, such as palliative care, we've had long-term workforce vacancy in that area. And so what we did was implemented, again, another supported transition program where you may have been out of nursing for a while or not specifically experienced in palliative care. So did a structured transition program in where we had additional support for education for the staff. Again, that was hugely successful. You know, managed to fill our entire workforce gap with one intake of that. Our learnings from that is we really want to start using that model across other areas because it has been so successful. Medical challenges are another beast, I'm going to say. They are systemic. They're extremely difficult, particularly in the specialty areas such as emergency or anaesthetics. And, you know, the other sort of complexity is, you know, potentially when you're competing against other organisations that have similar gaps and might be located on the other side of town and people live over there, you know, what's that employee value proposition to get people to want to come and work here? And I suppose that's some of the thinking around, you know, particularly with the Cert 3 program on how can we support the people of Wyndham who, you know, we have a lot of staff who live in Wyndham and work here. So how do we really start giving more opportunity to the Wyndham community and have that ability to work closer to home, you know, because it does affect that work-life balance and I suppose, you know, address some of that burnout in healthcare. And, you know, for me, I live in Point Cook, so I'm, you know, literally 6 minutes away from home, and it's the first time in 30 years that I have lived so close to work. And it does change your life, you know, it gives you a bit more of that balance and not being stuck in traffic, etc. So they're probably the I suppose some of the things that we're looking at that we've had some success with, and thinking about how do we translate them into other disciplines.
Fantastic. And following that thought on the Wyndham community, Marie, I guess given your quite extensive experience in the field, what do you feel is your vision for the future of healthcare in Wyndham? What does that look like, and where does Mercy Health play a role in that?
Yeah, that's a good question. So I think, ultimately, what do we want to be? We want to be, a growing organisation that's, recognised as a leader in the provision of healthcare, and, making sure that we do provide compassionate care with empathy, and that care's, contemporary for all patients, and that we really look at how we grow our models of care and our systems to meet that growing demand so that we can be self-sufficient. I think that when you look at what are some of those, when we think about, well, what's our focus, it is about investing in our workforce, and building a culture that is positive and supportive, where people want to come and work here, doing a lot of these programs that we've done recently, like that does get communicated by word of mouth, and you want people to come and work in an environment where they do feel supported and challenged and have opportunities for professional development. So there's a lot of investment in the workforce and the culture. And I suppose recognising that, in health, you are here to serve the community. You are here to serve the people of Wyndham, and what does that mean? And I think when you have an organisation with so many people that are from the city of Wyndham, it's a little bit different, because you're giving back to your community. I think the other areas would be, looking at how we can look at innovation and, different models of care and different types of care. And COVID was a good soundboard for that, with a lot of the telehealth medicine and different opportunities. I think there's a lot more opportunity in that space to look at how we can develop further and really think about how we harness some of that digital health and technology. And I think the other probably key factor is, which something Mercy Health is very passionate about, is, being that leader in sustainability, and looking at how we do give back in that space, not only for the organisation, but for, sustainable models of care and workforce that are able to be here long term.
That's incredible, Marie. And I think, a lot of what you're talking to really resonates with me, like in my own personal value sets, but also the work that we do with Opportunity Wyndham here at Wyndham City around, sustainable workforces, sustainable community. Just incredible. Thank you so much for sharing all of that, Marie. Incredible work.
Thanks.
I am going to now head across to Abby Mzungu, who is also at Werribee Mercy Health, but at Werribee Mercy Mental Health. I had a little brain freeze there for a second. So Abby's a social worker who's been with the Wyndham community team since 2013, arrived in Australia from Zimbabwe in 2009 to pursue further education, graduated in 2011 with a double master's in public health and health promotion, became part of the management team in 2017 and as the team leader, and moved into acting manager position from July of 2021, and subsequently became the permanent manager in January of 2023. So congratulations on that one, Abby. Abby oversees the day-to-day running of the community team that services Wyndham and a part of Hobsons Bay, and manages a multidisciplinary team comprising of doctors, occupational therapists, nurses, and social workers. Abby has been part of a lot of positive changes happening within the service to continue to train clinicians in the ever-growing field of mental health, and is passionate about the ongoing growth of clinicians in helping clients living with mental illness to reach their highest potential. And I can say that firsthand, having come from IPC Health, who has a co-located with Mercy Mental Health down in Hoppers Crossing, first-hand witness to the great work that you do down there. Abby, how did your journey from Zimbabwe, to Australia go? And oh my gosh, hang on a minute. Okay, the question's worded a little interesting. How did your journey from Zimbabwe to Australia come about and your double masters in public health and health promotion shape you in your current leadership role at the Wyndham community team? There we go, got that question out.
Hi, can you hear me? Oh, good. I had trouble, so I missed the first couple of speakers, and I apologize for that. But fortunately, I got in on time. And thank you for inviting me. And look, I think starting off with my journey from Zimbabwe, it started with tears, obviously. I was a bit nervous coming to a new country, but I wanted to pursue my master's in public health. Having a social work background back in my country, the public health is or was mostly at that point offered to doctors only. So it was a good opportunity to just come and do something different. And because I'm so passionate about health, I actually never thought I would be in health as a social worker. I thought I would just work in public health itself. So coming in, I guess the question is really focusing on my leadership and how it's been shaped really by coming or journeying from Zimbabwe to Australia. So I think, look, I've always been a leader for as long as I can remember, but coming to Australia, I just really thought to take a step back and understand the culture a little bit more, understand people, understand how things operate. And I took a step back for quite a number of years after my studies and the jobs that I did, and which was helpful for me because it just helped me analyze the situation, the system around me, because it's totally different from where I come from. And just having to get a good grip about even personalities, because you manage people, you manage the way people think, not think, but the way people act and all that stuff. So I had to really understand that myself. So it took me a while. And even when I got into the team leader position, I didn't think I was ready, but obviously people around me thought I was. So I got into that position not because I wanted to, but it found me. And I think it was more so just from putting everything that I've known about myself and understanding the different health systems and understanding the different cultures that I would say has shaped my leadership within Mercy. So like I mentioned in my bio, I think I got into the leadership role back in 2017. So I'd been supporting the team since then and now in the management position. But where I sit is really good because I get to hear quite a lot about where the services come from and where it's going, and being part of that is really quite a big privilege to be able to shape some of the future things that we do, and having been a really big part of some of the innovative projects that we've done and working through, because I think at the moment I'm one of the longest serving clinicians where I am at the moment. So it's good to see where we've come from and sitting where I'm in a position to influence as well where we are going is good. So it has been an interesting journey. It hasn't been too tough, if I have to look at it that way. But I think it's just about allowing or having allowed myself to assimilate with the society, with the different cultures, and to understand, even with my case management, when I started as a case manager, I remember being very nervous initially because I'm from a place where you have to give tough love, and I had to step back. I was like, let me understand a bit about this before I get in, because in mental health you need that as well. So up until I just found my own 2 feet and I had my own style of case management. So I believe that has also strongly influenced even my leadership skills, and the way that I operate is now comfortable to me as an individual, if it makes sense.
Yeah, fantastic, Abby. And I think just balancing, like acknowledging your journey there and balancing that challenge for yourself. I mean, we've talked a lot today around the broader challenges facing the sector. I guess what are some of the unique challenges that you and your team are facing at the moment, and how are you going about addressing those challenges?
I think you can just use the script that Marie has given you, because it's pretty much the same. I'll pretty much echo the same things because we are in the same health sector. Organization. So it's pretty much the same, and I think it will be around and the same for most of the organizations anyway that we've said that are here representing. So I'd say, look, in all honesty, one of the biggest issues is resources at this stage, and this was really impounded by COVID. And when COVID came about, and now it's still there, but at least things are almost back to normal, or the new normal as we call it. But we had issues and struggles significantly with recruitment and with resources and managing this massive growth area of Wyndham. And our resources are just not meeting the need at the moment. So I think that's one of the biggest challenges. And running a clinic where we also have challenges with medical staff, doctors' unavailabilities, and as well as not just feeling the EFT at the pace that we are getting referrals, it really is a big challenge. At the moment, clinicians-wise, we are not too bad. We still don't have full EFTs, but we are definitely not where we were 2 years ago. And we're trading quite okay. And it's also pretty good for our team, especially. I can't say that for all the mental health teams, because some of them are still struggling pretty significantly with recruitment. So I think one of the advantages of being in Wyndham as a big growth area is also we do have quite a lot of people who want to come and work in the team. So that helps balance us to some extent. But in terms of the specific disciplines are really still quite hard to recruit into. Due to NDIS coming on board, I would say, then you have things like allied health, OTs being a challenge to get into the teams. We have psychologists who are really challenging to get a hold of as well in public mental health. So we have certain positions that have been open for close to 2 years that we haven't been able to fill, particularly eating disorder. So we have those challenges because we consider, or it is considered as a mental health. And now having to look really closely into linking the two, mental health and eating disorders, getting clinicians to come on board is really one of the biggest challenges at the moment. Then we also have to deal, and unfortunately we have to deal with government expectations, whereby our contacts and our funding sources, our reporting systems have to match the expectations, and which in most cases, due to the fact that we have so much more work that people have to do, it just doesn't match up with the expectations that the government has for us. And unfortunately, we end up losing some of the funding because of that, because it's not matching. It is a real problem because when we get funding being taken away when we need it the most, that just leaves us with a really big gap into the service provision that we have to deal with. What else can I mention here that is
I'd be curious to know, Abby, for you mentioning all your staffing issues, if people that are in this webinar today were looking to get into mental health, where would they get started in that? How would they enter that field? So
in mental health, I'll say both in the inpatient as well as in community, we do recruit specific groups of professions. So that's social workers, OTs, psychologists, nurses, and so allied health, social workers, OTs, psychologists, and nurses. So 4 groups of people that we recruit. There was some requests to get dietitians on board, but that was declined as well. We were hoping to expand. So if someone wants to get into mental health, if they've got those 4 professions, then depending with where they're at in regards to their own profession itself, if they're like graduates, we do have grad programs to allow people to come into mental health. We have postgrad programs and grad programs for nursing. So nurses will have 2 streams that they can get into mental health with. And then of late, I think from last year, we've had this expansion as well with early workforce recruitment as well, where we've had funding from the government to get people into transition programs. So it might be someone who's doing social work, say, maybe in the medical field in the hospital or any other field that's not mental health, but they want to come across to mental health, then they can get through that program where they transition from one area of social work to another. So when they do come across in the grad, postgrad, and transition programs, then they get really significant support, because it's a really supportive system that is and has been put in place now to support people who want to transition and come into mental health. We understand, and it has been known now, that just coming to mental health from the blue without having prior knowledge or support, it can be really daunting, and that also has led, or in some cases leads to the high turnover of staff. So you want people to have that soft landing into mental health and understand it a little bit more. So I think those are the main pathways that people have been coming to mental health. When I joined mental health way back 10 years ago, it wasn't there. So I felt I was pretty much thrown into the deep end. Sometimes it's the best way to learn, for sure it was for me. But I think now it's more supportive that people get these different pathways to come. And previously it was only the postgrad program for the nurses, and then all the other disciplines would just come with whatever experience they came and have transferable skills. But now there's a more supportive way of coming into mental health. So these jobs, these programs, they run for 12 months at a time. And usually when those 12 months are up, if there's a vacancy within the team, then people get to stay within the team. So it's also a way that was introduced to try and get more staff within the service and retain staff as well. So these jobs are usually up on SEEK in most cases, Indeed, and all the other advertising positions. And people can be free to contact the education department as well to check in to see when the next recruitment is going to be. But they usually start from February, and adverts are usually up from I'd say probably around August and moving on, and people can just start checking and seeing how far or when those openings are going to be. So those are the ways that people can join and come into mental health.
Thank you so much for sharing that, Abby. A lot of challenges in your space. I feel for you. In the interest of time, I'm going to move to the next panel member so that we've got a bit of time for questions at the end, because we've got some great questions coming through from some of the registrants today. We may run a little bit over, everyone, if that's okay. I'll try to keep the rest of us moving fairly straightforward. But again, thank you so much for sharing that, Abby, for sharing your experience and your really, really incredible journey. I am going to jump over now to Yolanda Sutherland, who is the Acting People and Culture Manager at IPC Health. Yolanda is a professional with over 30 years in the workforce, a migrant from her early childhood. She's the first in her family to earn a university degree, embodying resilience and determination. Educated in Victorian state schools and the Victoria University Footscray campus, she holds a bachelor's degree in humanities, a master's degree in business administration, a certificate for and training and assessment, and is now a qualified nurse holding a diploma of nursing and registration. Very, very busy. Navigating through challenges faced by migrants, Yolanda has forged a career in human resources, health and safety roles. Passionate about learning and recognising the unique gifts of individuals, she joined IPC Health during the COVID-19 pandemic and quickly found her place in the People and Culture Department. Currently, Yolanda is the Acting People and Culture Manager at IPC Health, a position she has embraced for the past 6 months. With a dynamic team, she highlights the amazing diversity of human potential in her organisation. Yolanda's journey is a testament to the power of perseverance, ambition, and nurturing talent. So, Yolanda, how has your experience as the first person in your family to graduate from university impacted your perspective on education and career progression?
Thanks, Keith. Thank you for inviting me. As a young person, I was quite a conscientious student and always curious about learning. When I reached the end of year six and was very proud to be on the way to go into high school, a curious thing happened to me. Someone from a circle of my parents' friends told me, "Well, you may as well not plan too far ahead like the rest of us," and chuckled. I couldn't understand the person. I didn't know them and they didn't really know me. Well, I'm also persistent, very independent and passionate. So my first thought at that young age was, I shall follow my dreams and do my best. So when the day came when I received my Year 12 HSC pass, my plan was to go to university and be the first person in my family to get a degree and make my family proud. Those words of not to go too far resonated with me, and I did complete the complete opposite. I became more passionate to achieve and progress in my career to what I wanted out of it. And I would seek out opportunities instead of waiting for things to happen. I openly asked for help. I was curious and inquisitive to find out how other people got to where they were, and I took the opportunities to ask and find out more and reach out to so many supportive people. And I can tell you there are a lot of people out there who are willing to listen and provide support and help you along your career journey. It is also about your own fulfilling achievements that you wish to accomplish. So, moving across and around an organisation are great ways to progress and strengthen your career. So, with this personal experience of mine, I am now paying it back through supporting and nurturing new generations and others in the workplace. Those people who guided me in my first years and onward, those people who took the time and shared their knowledge with me, I can now do the same for others. And being in people and culture really enables that dedication and commitment. So, my words of wisdom: keep positive, keep aspiring to what you would like to achieve and contribute, and seek out the help and support that you might need to achieve it, and you will.
Thank you so much, Yolanda. Thank you for sharing that really inspiring message. It's definitely what I needed to hear for a Tuesday afternoon. So Yolanda, I guess what I'm hearing and what I'm seeing is you definitely could be considered a lifelong learner. What is, and I guess coming from, you've got quite a diverse experience, you know, as a young migrant in Australia as well. What are some things that IPC Health are doing around diversity and inclusion within the organisation? And further to that, what are the opportunities for people to professionally grow or learn as an employee of IPC Health?
Yeah, certainly. At IPC Health, there are a number of initiatives and strategies that foster diversity and inclusion within the organisation. Our future workforce strategy initiatives include establishing new entry pathways to attract new candidate pools, early career changes, and people with lived experience, people from diverse communities, and innovation focused talent. Our lived and living experience focus has gained traction through a collaboration of several key leaders and personnel working together to equip leaders with professional training and an organically designed and written document specifically for IPC Health that has been developed very proudly with the PNC team, very much as leading that document, guiding leaders through the recruitment and onboarding, supervision and support of lived experience personnel within their teams. Through workforce flexibility, we are able to support our staff needing to balance work life and work study to support them to improve their skills and return some of that back into the workplace. We've also been exploring options for some very, very difficult to fill positions and looking at such things as even overseas options as well, where we can. Um, There's also the student placement and partnerships program that we have with various universities and TAFE colleges in the area, providing connection for IPC to welcome and provide support to diverse communities, giving them opportunities to experience work life at IPC Health and enabling that continued connection to perhaps near future talent pools after studies are completed.
Incredible. Thank you, Yolanda. There's some really great work happening there. Lots of opportunity, it sounds like, for people to grow once they even get in the door, even before they're even through the front door, which is fantastic to see. I guess from me, Yolanda, and you've spoken about it already, and as a lifelong learner yourself with a number of different pathways within health, I mean, you've just recently completed your diploma of nursing, which is incredible. Drawing on that extensive experience, what advice would you give to someone considering a career in healthcare, or wanting to understand more about healthcare in our community, or say within community health itself?
Yep. Oops, sorry, just scroll up a tiny little bit. So at IPC Health, we offer professional development learning opportunities. We have a learning management system. There's also compliance learning, but there's also other opportunities to advance and strengthen your career through things such as secondments. Additionally, there is face-to-face or online learning opportunities that our organisation provides for specific areas, such as our clinical programs. There's also informal learning, buddying, and supports that are available. We also have the flexible working commitment, and allowing people to explore perhaps personal study ideas and options, and being able to provide them that work-life balance.
And what advice would you give someone wanting to step into community health? Where would they start?
Yep. So my advice is do some research, go to the community health centre web pages that you're interested in to learn about the organisations and what it offers and what might interest you in working in a particular community health organisation. Seek out courses to improve your knowledge and skills. So make inquiries with education providers on courses that might be available. For example, in the child and family healthcare sector, we're finding it more and more challenging to get people in that area. So if you're interested in moving into something along the lines of a practitioner, that would be something that is, a lot of opportunities are coming through there. Allied health across all sectors, I think, where we are struggling to get good podiatrists and even support staff in those areas, physiotherapists and more. General practice administration staff as well, with solid systems such as best practice. We're on the lookout for those talented people. So if you've got some reception and you want to skill up a bit, those are the sorts of things you could be looking at to get into the community health sector. See where courses might be free, and reach out to TAFE colleges, find out a little bit more information about all of that, which could actually help you to get into the community health sector. Um, there might be opportunities through undertaking courses that you can undertake a work placement, which will then give you some further insights into the sector. Sometimes, with some, probably more non-clinical than clinical, is recognition of prior learning. So sometimes you might already have some experience, workplace experience, or some current certification that you can actually credit towards something that you are studying as well. So that might cut back some of your time studying and get you to fast track into community health quicker. Also, social media. So, utilizing social media such as LinkedIn or Facebook or others to connect and keep up to date on the latest information on healthcare providers, and volunteering. So, reach out to a volunteer program. It's a great way of learning more about an organisation and getting a foot in the door in the sector.
Thanks so much, Yelena. There's some really great pathways in there. I think to end on volunteering is a really great one as well. People don't often think as volunteering as a pathway to employment. A lot of organizations often try not to make it that. But I guess again, pivoting from COVID, if there's one thing we've learned coming out of it, volunteering is a great way I found in my own experience to get exposed to different pathways. And you mentioned TAFE as well, and we've got Minnie who we'll talking to very shortly around some options around TAFE offerings as well. Thank you, Yolanda.
Thank you.
I'm going to head over to Nis now. Nis Patel is the General Manager at Felicity Holistic Care. Nis manages the day-to-day corporate operations of Felicity Holistic Care, quality, finance and human resources function areas with a focus on providing a high level of service and satisfaction. This includes the oversight of sourcing and hiring the workforce and accounts function. Nis has a master's degree and over 13 years experience as a project manager, team leader and change manager. And he's also worked in startups, education, insurance, IT, entertainment and healthcare industries and has successfully run his own businesses. Oh, that is a lot, Nis, that is a lot. So with a background, yeah, that's a lot. So with a background spanning numerous industries and years of leadership roles, how does that influence your current role as General Manager at Felicity Holistic Care?
It's a great question. So before joining Felicity Holistic Care, I was working across various industries, as you mentioned, and they were all very corporate focused, like very business oriented, very corporate roles. A few years ago, my nephew was diagnosed with disability, my brother's son. And that's when I thought to change the pathway, and I wanted to connect with one of the organizations. And then when I joined Felicity Holistic Care, I saw that, yes, it can bring change in people's lives, and I could bring my experiences across various industries. It could be from legislative changes, it could be from human resource experiences, from change management, how to foster the growth foundations so that business is sustainable and can grow, and it can balance both. So I could bring all of those experiences together, and with all of those experiences, we could foster a mindset. We could empower our teams to work with empathy and to provide services to anyone in the community with holistic approach, because that's the root motto behind this organization. It also, my experience also allowed me to foresee the future, needs, opportunities, challenges, and how to overcome that before even that happens. So, for example, this current workforce shortages that everyone is facing, no doubt, starting from a small cafe to a mining giant, everybody faces workforce challenges. So with my experience and with the experience in statistics and analysis and data analysis and project management, I could foresee that, yes, something like this could happen. I couldn't know like exactly what would happen, and that's where we put our preemptive steps in place. And that's where, as an organization, yes, we were affected, but not massively. So these are some of the examples where my background definitely helped the business, and business definitely helped me to understand the human factor of the business and also the services. Like, we are here to serve community, so that factor always has to be there.
Yeah, fantastic. Thanks, Nis. And so I guess what kind of what are the qualities in people that you're looking for? I mean, there's workforce shortages. Yes, we've gone round and round on that one.
Yes.
What qualities are you looking for in an employee? And say once they reach Felicity Holistic Care, what growth opportunities exist within your organization to support that person?
Definitely. Look, I think it's a two-part answer I'll give. And I'm mindful of time as well, because it's close to 5-ish now. So look at Felicity Holistic Care specifically. We got a very diverse team. We got people from 20 years old to 70 years old, different age, different skill level, different cultural backgrounds, different capabilities, and even people with disabilities as well. So we definitely, first and foremost, we look for people who are a fabric fit, like who fits the fabric, who fits this very vivid, fabric of our organization. Once that is ticked, then we look for people who share the same vision and passion as we do. Because if people are not with the same sense to give back to community, to work for other people, to work for community, then we think that sometimes some people might be in the wrong industry. So to give, to sense to give back, to a sense of belonging towards the community should always be there, because we should have responsibility towards the community. Once all of those are ticked, then we look for someone's willingness to learn and grow. People sometimes confuse growth with job titles or remunerations, but growth can be in many different aspects. It can be in our how we work with other people, how we are we learning new things, are we cross skilling, are we widening our horizon of our skill set. All of that is growth. And when once those growths are achieved, then the natural growth of within positions and the higher management skills and all that, it does come automatically. So we are looking for people with learning and growth mindset. We do have many experienced team members who have come with years and years and years of experience within the industry, and however still we all work together to take our game to the next level. So those sort of qualities we look for in our team members. We call them team members. We are all in one team. And once somebody joins, then definitely there are opportunities for growth. I think every single team member would vouch that we say that we grow together in the organization. We are a growing organization, and that's why it goes back to the same thing that we need people with growth mindset. Many of our leaders, they started at one position, and then now, after years, they are now at a senior position or executive leadership positions as well. As Marie and Jenna shared earlier as well, many people have moved sideways and within the organization, and they have found their field of interest, and they're like, no, sorry, I was doing this one thing, but I really like this other thing. And okay, that's my mojo, and now I want to get to the next level within that. So that has happened as well within the organization. Quite a lot of our community team, our work is quite heavily based on supporting community. So quite a lot of our community team leaders have, pretty much all of them, they've started at very entry level, and now they're leading teams of 7, 10, 15 people on a day-to-day basis. So growth is always there in terms of whether somebody wants to learn, career change, even moving sideways, learning new things. Yep.
Fantastic. Thanks, Nis. And I love that you acknowledged, I had noted to note Jenna and Marie's answer as well, because I think, yeah, you've acknowledged as well around being agile. It really is around mindset, as Jenna was saying, and it's not always about jumping from, from the bottom right up that ladder. Like Marie was saying, sometimes it takes a sideways move to really find something that matches what you're looking for, to open and broaden, put you onto different growth pathways. So I guess, Nis, for me, so there's some fantastic growth opportunities at Felicity Holistic Care. What are some of the actual initiatives or projects that Felicity Holistic Care is working on that you could share with everyone? What could people get involved in from an employee perspective?
Sure. Look, from an employee perspective, we are looking to, in the last 3 years since I've joined, we have doubled our business, or even more than that, 250%. I think that's what we're looking for in the next 3 years as well. So people definitely are, we will need people, and we will need people to grow within the business. In terms of initiative and projects, we are currently working on many projects where we are bringing awareness within the community. We are helping people whether they're stuck somewhere in their life, and they're getting one sort of support, one sort of model they're at. If they're at one position, how do we enable them to access everything that is available to them and guide them in the right direction? Many times we see many families that they do not have enough access or knowledge, or even cultural differences as well, where people don't understand. And that's where we are partnering with many not-for-profit organizations, many community organizations, from Etsy background, people who work with call backgrounds, and providing them the resources that they need to enable them to further reach to the community. Many times we do this without even Felicity banner. So we go out there pro bono and we have these sessions, information sessions. So there's quite a lot of those community-based initiatives that we are working on at the moment. We are partnering with universities at the moment where we can further provide training and career pathways and learning to our current employees. Let's say if they're, I don't know, certificate level 3, they can go to 4 can go to diploma, and then that way they can study further as well, and they can upskill themselves. Yeah, so these are some of the initiatives and projects that we are undertaking currently at Felicity Holistic Care.
That's really great to hear, Ness, and I think you're reflecting in some of the work that Yolanda was speaking about earlier around diversity, equity, inclusion, and I think we're, as evidenced by a number of our experiences shared today, I think it attracts a really quite diverse workforce, and there's so much opportunity in that to help people grow and to help people work together. I think it's incredible that you're really focusing on that one. Thank you for sharing this. And sorry if it feels like I'm rushing everyone along as well. I'm appreciative of the generosity of the panelists today and of people on the webinar by staying over. I'm going to pass over now to Minnie, who's going to talk to us about some excellent TAFE offerings of the Gordon. So Minnie, with a wealth of experience and diverse skill set, Minnie is a versatile professional. As a counsellor, they run their own wellness practice, providing valuable support and guidance to individuals in need. Additionally, as a dedicated teacher, imparting knowledge in the Diploma of Community Services. Having worked extensively in the community sector, managing capacity building programs for people with disabilities, refugees and those with mental health conditions from culturally and linguistically diverse communities, and possesses a deep understanding of diverse needs. Furthermore, their passion for holistic wellbeing is evident as a certified yoga teacher, promoting mindfulness and self-care. Through their various roles, Minnie strives to empower others and foster positive change in their lives. So Minnie, what are the key skills and knowledge areas that students should develop to succeed in the community services sector?
Thanks, Keith. So I'm not going to rush through, but I am mindful of the time. So some of the key skills, I think they've already been mentioned. Curiosity is definitely one, like Jenna said, being open-minded and being flexible, adaptable to change. When you work in the community sector, like I did for that many years, I think things change every day. No 2 days are alike, and you can see different clients every day as well. So having an attitude to learn to adapt is quite good. I also think having worked with people from culturally and linguistically diverse backgrounds for that many years and leading programs in the psychosocial disability space, the communication skills and also an ability to be non-judgmental and understand your own bias is quite important, because you go into homes and you go into families that might have values and belief systems that are very different to you. By studying something like a diploma in community services, where we do teach cultural awareness and cultural competency through units, we develop those key competencies. So that's really important, I think, as well. And communication skills, understanding really what a person-centered approach is, and looking at every family, every individual as a person, and not generalizing, especially when you're working with, people with diverse needs or diverse abilities. That's really important as well. So empathy, that's a skill, and also being able to look after yourself. So staff shortages, burnout in the community services sector is high, the rates are high. So being able to look after yourself while you're doing all of that would perhaps make staff stay there more. So agencies should be looking after that as well, looking after their staff. Knowledge, I guess, apart from the qualifications. So I know if you want to work in the community services sector, if you do a diploma in community services, you can go into, legal justice. You can work in the justice system. You can work in community-based mental health programs. You can work as a case manager. You can work as a intake officer. You can work at the council. I mean, you can work as a disability support worker, but you would have to do a disability Cert 4 in disability for that. So community services, the course opens up pathways to different different areas of interest or passion that might align with you. Also being aware of the current trends. So there is a shift towards adopting holistic models of care, towards digital transformation, towards there's shortages in aged care and allied health and disability. So being aware of those trends and, being aware of the Victorian skills shortages. So, what course do I need to do? Free courses online like the MARAM framework, if you're interested in family violence, doing that course, then, the NDIS workers orientation module, if you're interested in disability, do that free training online before you enroll into a course to find out whether you've got the skills that you really need. Awareness of the NDIS and My Aged Care packages, how has funding changed in the community sector? And how are, mental health issues compacting on people already affected by disability, or people who are older, or people who are in that space between NDIS and having a disability that's not diagnosed, or having mental health issues that are not diagnosed. So being aware of all of that, I think, would help students or people who are interested in working in the sector to kind of, succeed in the sector if they wanted to make an entry.
You've done me a solid, and you've literally answered.
I'm sorry if I rushed through, but I'm mindful. I'm teaching from 6 o'clock. I'm teaching from 6 o'clock. So I'm just like, I need to get this through. Yeah.
No, I think if there's one thing I want to pick out, Minnie, I guess you mentioned things like the MARAM framework, and I guess quite relatively recent reforms in that space that are quite complex. And I know there's a number of organizations even that have evolved to really support businesses to implement that framework. I guess following on that and the complexity of what exists in that space, are there particular industry certifications or credentials that you think students should focus on, given those current trends you mentioned, to help them gain employment in the sector?
Yeah, so look, for family violence, I know they're developing a new course that you have to do for a couple of years, or you need experience in that area. In the Diploma in Community Services, we have a unit which is developing understanding how to respond to people affected by family violence. So that's like an entry-level unit, and I'm actually teaching that tonight from 6. So you introduce the MARAM framework to people, and then on the Safe and Equal website, you can do a one-day course. What that kind of gives you, and I have students in the past who have had jobs, entry-level jobs at Orange Door. So if family violence is something that interests you, I would say you can get an entry-level job with a diploma. But if you wanted to go further, I think you'd have to study social work or do something specific to be a specialist in that area, because it needs not just personal experience or lived experience, also needs those skills that you need to work in that area as well.
Fantastic. That's really helpful, Nis. Thank you. And I appreciate your energy and effort in
you just called me Keith, you just called me Nis. I'm actually Minnie.
Oh, Minnie, sorry. I'm looking at Nis. Sorry, my goodness. I'm looking at Nis, and sorry, Minnie, sorry. Thank you so much for sharing that. And I think it also talks to just how late in the afternoon it is. Thank you so much. And if people want to find out more information about the Gordon's offering, obviously they can jump onto Gordon's website, and they can explore that on there as well. Awesome. Thank you, Minnie. Now, we've had a number of registrants today ask some questions. Now, it is already 20 minutes over time for a 1-hour webinar. What I'm going to do is, Surya from our team has really I appreciate Surya pulling that together into our Q&A function. I'm going to collate all of these questions. I'm going to send this to the panel team. So if there's questions in there that you think are attributed to you, we'll get you to answer those, and we'll send that out, team, to everyone that's registered today's event. We'll send you an email with those answers collated from each of the panel members, just in the interest of time. But thank you for submitting those. Thank you again, panel members, for your generosity in sharing your experiences today. I think there's been some great questions in the chat. There's also been some great comments as well from people around, the different empowering messages that have been said today. I hope out of today's session we can generate some future workforce for you all experiencing those challenges. And yes, Faisal, there is a recording of this session that we will be sharing out with people that have registered today as well. Thank you so much. Have a great night, and good luck. Good luck, healthcare crew.
Thank you. Thank you.
Thank you.
Thank you, everyone.
Thank you so much.